Hey guys, my name's Kelly. I'm going to do my speech today. I'm going to go ahead and apologize because there's like a gazillion tongue twisters in it. So here goes. Physician-assisted suicide is the act of initially killing oneself with the assistance of another who deliberately provides the knowledge, means, or both. In physician-assisted suicide, a physician provides the assistance. The debate on physician-assisted suicide is by far not a new issue. It dates back to the ancient Greeks and Romans that advocated euthanasia. After so many years of this debate, why can't we just agree to disagree and base a decision solely on an individual case-by-case basis with the person's decision being final? Today I'm going to tell you a little on why I think physician-assisted suicide should be legalized, yet heavily regulated, based on liberty, dignity, and even financial reasons. Hopefully this will open your eyes and possibly even open your mind. The American Medical Association policy strongly opposes any bill to legalize physician-assisted suicide because the practice is fundamentally inconsistent with the physician's role as a healer. But we can't all be healed from every disease, can we? Until we can heal or cure all diseases, who are we to make a person suffer until their final demise? As an adult, can we not be trusted to know when enough is enough? Dr. Charles F. Miller, a retired oncologist that co-founded the Physician Advisory Council for Aid in Dying in Hawaii, said, "I know people call it assisted suicide, but this is not suicide. These patients are already going to die. All they're asking for is, can I have a choice in how to do that or how to end my life?" Opposing people may argue that physician-assisted suicide is not within the rights of the medical field to help patients die, but to help them improve or at least continue life, no matter what its quality may be. No matter what its quality may be, I don't know about you, but being in excruciating pain or a vegetative state, that's no life at all. Let's not even talk about the quality of such a life. We're all familiar with the infamous Dr. Death, Jack Kevorkian, who gained notoriety in 1990 for assisting the suicide of Janet Atkins, an Alzheimer's patient whom was actually a member of an organization that advocated voluntary euthanasia for terminally ill patients. Kevorkian said, "Am I a criminal? The world knows I'm not a criminal. What are they trying to put me in jail for? You've lost common sense in this society because of religious fanaticism and dogma." He also said, "You're basing your laws and your whole outlook on natural life on mythology. It won't work. That's why you have all these problems in the world. Name them. India, Pakistan, Ireland, name them. All these problems, they're all religious problems. We have separation between church and state for a reason. We all have the right to our own beliefs, but in this case, it seems that religion is clouding our judgment and more important than our liberties. Many of these religious groups claim to hold all life as sacred, and by taking a life, even though it may ease someone's pain, is not an acceptable act in the eyes of God or within Christian tradition. Suicide is seen as this grave sin, as murder. The right to die with dignity is trumped by the need to adhere to this religious code, and although one cannot criticize individual belief, it should be noted that the benefits of seeing someone die with peace and grace is also something that is, in some ways, wholly unjustified. Kevorkian also said, "I hate to say this, but I'll repeat it. After death, all we know that you do is stink." Not all of us believe in heaven and hell. Not all of us should be held up to your religion or your beliefs. Some people believe that when we die, that's it, that's the end. And if that be the case, I'd choose to do so with peace and dignity. As one study notes, the last month of life of a terminally ill patient can consume 40% of the total spent on healthcare during the lifetime of an individual. Those of you thinking that once given permission, doctors would just go on this crusade killing patients, think again. 40% in the last month? Seems to me doctors are making most of their money while you're lying there suffering. I'm not saying this shouldn't be something heavily regulated, but it's something that should be an individual choice. It should not be up to the states or federal regulatory commissions to decide the individual fates of citizens in such a personal matter. This is a choice left up to the individual and their families. Bringing a child into this world is a personal or family decision, and taking yourself out, that should be one as well. If I'm terminally ill, the last thing I'd want is to suffer for weeks on end while my family sits watching me, taking turns by my side and eating the hospital cafeteria food, only to leave them with this unsurmountable amount of debt. Where is the dignity in that? In reading of the 4 myths about doctor-assisted suicide, it stated that in Oregon between 1998 and 2011, 596 patients used physician-assisted suicide. That's about 2% of dying patients in the state. In the Netherlands, where euthanasia and physician-assisted suicide have been permitted for more than 3 decades, fewer than 3% of people die by these means. And if we add all the dying patients who even vaguely express an interest in assisted suicide, it amounts to much less than 10%. For the vast majority of dying patients, it will have no impact on improving the ends of their lives. And being that such a small number of persons in the states that allow doctor-assisted suicide, shouldn't this be something left up to the individual? That is proof enough that we won't have some pandemic on our hands if we are given the option to make our own decisions. We are adults. Shouldn't we be trusted? Why is the government making decisions on our behalf concerning our right to liberty and life? Are we really the sheep that we are so often called? Thanks.